How come there's no Steve Jobs in healthcare?
Normally in a market, if somebody comes up with something new, if Apple comes out with a sensational new iPhone, you know Samsung and others are going to be soon coming out with stuff that says, oh, we're even better. The market responds quickly, which makes 2 points. One, not only do they respond quickly, but even though the individual in and of himself, herself is powerless, the competition forces these providers to give you that information so that you can make a decision to buy what they're offering. And in the healthcare, that doesn't really exist. It's you're supposed to be very passive.
Look, your fundamental point, which I think applies to all industries, is without real competitive pressure, you don't see that type of dynamism of, oh, there's a better idea the guy across the street has, I better copy it, which explains a lot of progress in a lot of industries. The benefits of copying are often not as widely recognized as they need to be. And what you do say is, I better do something a little better than that person does. You know, in healthcare, we've made the decision that the customer actually decides what the seller can offer. It's just the customer, insurers, and Medicare. And so if you have an innovation, you got to convince an insurer or you've got to convince Medicare that that's something they will reimburse for. Well, that's an extremely complicated and time-consuming thing to do. And you don't have a lot of incentive to do it. You go to healthcare innovation conferences and somebody invariably says, how come there's no Steve Jobs in healthcare? Well, there's extraordinary numbers of unbelievably bright men and women trying all sorts of innovation in healthcare. Obviously, on the therapeutic side, it's remarkable. There's just no business opportunity, not enough of a business opportunity. One of the things we try to do at Sesame, one of the long-term goals of Sesame, is by taking advantage of the fact that a meaningful part of American healthcare, about $250 billion now, is spent out of pocket directly by patients. We might be able, through a marketplace, encourage some of that innovation. So now if I'm a doctor who's thought of a clever pre-diabetes package, or a different way of packaging maternity care, or a different combination of services that works for certain patients but not all, I can list them on Sesame and I can find buyers. We're about to do this in maternity, in fact. You're not going to be able to do that in the reimbursement market, because I've got to convince some giant company to reimburse that to everybody. But in the individual market, I can actually say, here's an interesting new product. If it works for patients and it seems like a good value, it starts to succeed. And so in that sense, what we're trying to do in Sesame is take this small corner of the healthcare market and build the incentive for innovation that really helps patients. And that, you know, what we hear also is a way that clinicians can be innovative in their therapeutic services.
So quickly walk us through, we mentioned earlier, telemedicine, which we got 8-10 years ago, grandparents talking to their grandkids. And now it's seen as, oh, COVID has given us this great breakthrough on telemedicine. Technology's been around for years. And yet even now, third parties end up making it cost 5-6 times what it should.
So I think telemedicine is almost the perfect illustration of why the third-party payment system does the opposite of what we think we're doing. And I don't want to sound critical of the innovators in telemedicine, because what they have done is they have fought through this thicket for a long period of time. But the reality is there's no technological innovation in telemedicine. It's a text or a phone call or a video. And as you say, Steve, grandparents have been doing it for grandkids for 15 years or so, 10 years or so. This is clearly not some massively complex technology. What's changed? It's now reimbursable, period. Because of COVID, many insurers said, we will now reimburse telemedicine appointments, or it's no copayment, or it's free, but only if you use our preferred telemedicine provider. We have a deal with one of the big telemedicine providers. If you use them, it's free to you. Let's think about what that means. Instead of encouraging competition in this service, I've now done the opposite, right? I've entrenched somebody. So what do the economics of that look like? What happens is, if you look at, and I think I looked at the only public company, it's unfair to pick on them, they're all in the same position, but Teladoc happens to be the only public company with big numbers. If you look at Teladoc last year, Teladoc did, I think, somewhere around 4 million telemedicine appointments. They pay doctors somewhere around $25, so call that $100 million. Their revenues were over $500 million. But Teladoc didn't make a $400 million profit. Teladoc lost money. And so if you cut through all of the financials, essentially what you have is the American healthcare system paid $533 million for 4 million appointments, which is $135 an appointment for something that doctors got paid $25 for. What's the delta between 135 and 25? The cost of third-party payment. Because Teladoc didn't make any money doing that. They will make money as that scales up with luck and good fortune, although that market's becoming very competitive. But it tells you everything you need to know, right? Well, here's a company that became big by selling employers and insurance on using telemedicine. But the cost of doing so overwhelms the cost of the actual service the patient is getting, which is talking on a doctor on a phone for 10 minutes.
So you take an insurance company, yeah, they try to deny claims and all that kind of thing. But in essence, they grow by having bigger revenues, especially with the Affordable Care Act, which had that 15% margin in there. And so in essence, they want more expense. They want profit, but the more money things cost, the better they do.
Yeah, this must be one of the great disconnects between the political understanding of the world and the business understanding of the world, right? Which is, politicians and policymakers have said we can rely on health insurance companies to push down prices, use their leverage, use their power, use their superior knowledge to keep the costs of care down, make sure excess care isn't being conducted, be really disciplined on price. And they do make a great show of it. But here's the problem. There's very little competition in the corporate health insurance market, which is really a self-insured administrative market. As you say, their margins, 15%, are set by law. And so cutting expenses doesn't increase your margins, right? It actually reduces your profit. So what's your incentive? Now, it amazes me that people can't see that one of the likely contributors to the cost of care increasing is that if you're an insurer, you make more money if the cost of care increases. You don't if it increases tonight over what you were planning for today, but over the course of a year, you're going to earn 15% above what you spend on care. You tell me.
Plus.
And a lot of the system works like that, and we don't recognize it almost because it's too obvious.